All right, so today I want to talk to you about starting a business in healthcare. And there are two ways in which you can get into business in healthcare. Say you're an innovator and you want to get into healthcare. You could either get in clinically or non-clinically. And in the clinical side, it includes maybe opening up a pharmacy, right, or a dialysis center, or something that most people think right away, medical doctor, DO clinic, or even a med spa. Some people think med spa is clinical, whether you like it or not. Yes, there could be ways you could do it. You could also open a dental practice, a chiropractic practice, right? So these are all clinical. And the key thing about this, it often requires regulation, as well as state engagement. Okay, when you open a medical or clinical healthcare business. When you do a non-clinical, though, it's more of a support service, right? You are supporting these folks, right? So it could be anywhere from a mobile lab, actually. That could be a non-clinical. You could do transport services, where you're transporting, maybe medical lab as well, or courier, right? Courier of items in healthcare. You could do even auditing. Now you're talking about, the business side of things. You could be a CPA specific in healthcare. You could have a cleaning business specific in healthcare. You see where I'm going with this? There are different things you could do non-clinical without having without following a regulatory path or following a state engagement. But clinical path is often one that has a higher risk and higher capital infusion, and sometimes needs medical oversight. So you might need a MD, a DO, or some level of doctor that is involved. But when you go the non-clinical route, you're basically offering business services to the medical folks. So if you've ever thought of getting into healthcare and you're not sure how to go, ping us. We could help you figure it out. Talk to you soon. Thanks. Bye.